Today on Brad's Bark, we have Leila, Dr. Jessica, and we're here for ultrasound to find out what's going on in Leila's stomach, to do a little bit of preventative medicine, and obviously to see what her health is like internally. Yeah?
Absolutely.
Let's do this.
It's important that we clip the abdomen of dogs who are going to have ultrasound procedure done. Reason being that ultrasound works on the premise of sound waves traveling through the soft tissues and bouncing off of structures in the abdomen to return a signal back to the transducer probe. And ultrasound waves don't travel through air. Now, hair traps air and therefore would interfere with the ultrasound beam, making the images very poor or nearly impossible to do. So although it seems a bit silly to have a shaved tummy, it's instrumental towards having the ultrasound be a success.
So this is Leila's first ultrasound, and so the reason Leila's here today is more along the lines of preventative medicine, if you will. Is that a good way to phrase it?
Yeah, for Leila today that is the case. We don't have any health concerns about Leila. She's reported to be a healthy dog. She's eating well, no vomiting, diarrhea. She's not on any medications, but we do like to practice preventative health care whenever possible. And that's the same thing for people as it is for animals. And reason being, if you can catch disease early, you have a much better chance of intervening in a way that means that you can keep your dog healthy longer. So whether it be ultrasound, blood work, any other diagnostic procedure, when it's done when an animal is sick, it's very important because you're there to try to figure out, why is the dog or the cat sick at this time? But preventative health care in terms of having an ultrasound done early, you could find things, that you could intervene with sooner.
What is the difference between ultrasound and an X-ray, though? So
an X-ray of an abdomen would show you the size and location of the liver, the kidneys, the small intestine, stomach, so on. But it doesn't allow you to look at the internal structure of those organs. And that's something that comes up in discussion often is a pet will come in that, say, does have an issue with their abdomen, they're vomiting. And owners might say, well, can we do X-ray or ultrasound? And that's a hard question for me to answer because they really do go hand in hand, especially in the patient who's sick. As a preventative healthcare measure, maybe ultrasound, and we can talk about that, gives us a much better in-depth view of the internal structure of organs. But for example, if you had a pet who was having trouble urinating, say a male dog, and if I did only ultrasound and I was, say, looking for a bladder stone, I might do an ultrasound of the dog's bladder and find no stone and say, oh, this dog doesn't have bladder stones. There's some other reason why he's having trouble peeing. And then we might sometimes miss something. For example, take an X-ray of that same dog, we might find that he actually has a stone lodged in his urethra outside of the range where the ultrasound can find it. It's a very important tool. So this is an ultrasound probe or transducer, and this is the wand, and there's a series of crystals that lie in the head of this ultrasound probe, and they are responsible for creating those ultrasound waves that leave the probe, enter the tissues, bounce back to the transducer, and then through the cord to the computer, and are then transmitted into an electrical signal that creates the images that we see on the screen. So we're not going to get into all the physics of it, but that's the basics of how ultrasound works. So we do apply some alcohol to the surface of the skin just to decrease that air barrier, so it's a bit cold.
Cool, it feels good. Hey, Leila?
A little bit of alcohol. Next thing we use is ultrasound gel. So this is just some thick gel, and we're going to apply some of that to the surface of the ultrasound probe, and that also now takes away more of that air barrier. Okay, so when we do an ultrasound, we always do it in a very systematic fashion, meaning I start with the bladder and I move my way through the abdomen in a very systematic fashion so that we don't forget any structure throughout the study. Now, the other thing that happens during an ultrasound is I take a series of images and videos. I want to make sure that I have a representation in 2 dimensions of each organ that we examine. Now, ultrasound on the screen, the density of tissues will determine how bright things appear. So ultrasound, everything appears from either black all the way up to super white. Things that are purely black on the screen are usually fluid, so that's just why I start with a urinary bladder. And our patient's panting a little bit, so there's a bit of a vibration going on, but you'll see the bladder appears as a black oblong structure. Okay, so, and then tissues, soft tissues vary in shade from dark gray all the way up to white, depending on their density. Things that are very dense, so if we encountered some bone, it would appear as a super white line because those structures are very dense. Okay, so I travel through each organ and make sure that I see its entirety. It's not sufficient just to look at the organ and say, okay, yeah, I looked at it. You need to travel through the entire structure and ensure that the entire thing has been seen. Okay, so and I also, you might have noticed, move my probe 90 degrees and I make sure that I take pictures of each organ in 2 planes.
So what is the importance of taking the photos?
So I take these still images for purposes of comparison,
Okay.
for one thing. So if I find do an ultrasound and everything is great and the patient's doing well, or even if I find something that isn't right in there, it's important to document that so that if, say, we repeat the ultrasound, be that days, weeks, months, years later, we have a method of comparing how things have changed over time. So let's say we found a cyst in a kidney, I can come back then, whenever that time frame is, take a second measurement, compare it to measurement number 1 and know how things have changed over time. The other reason why it's important is once I finish the study, this is sort of half the job, I then move this study to some software on the computer and do a series of measurements. So I can measure the kidneys, measure the adrenal glands, and compare that to normals of dogs of known size.
When should people be taking advantage of having the ultrasound?
7, 8, 9-year-old, say, Labradors, like Leila, for example, tumors in their spleen. We start finding those sometimes as early as 7 or 8 years old, and those are things, that's a prime example of something that can be done. Finding an incidental finding like that can save that dog's life because they can have that removed and carry on. So to answer your question, large breed dogs somewhere around 6, 7 years of age, 6, 7, 8 years of age. Small breed dogs, you're looking more like 10, 11 years of age as a rough. So again, a routine annual preventative health screen would include full blood work. Okay, so that's looking for organ functions, red blood cell, white blood cell numbers, trying to catch disease early, like early kidney disease, diabetes, changes in pancreas levels. So that's important, and then the ultrasound, of course, allows you to find incidental lesions in organs that could be a big deal later, but if caught early can be mitigated. As I'm traveling through the abdomen, so far I've looked at her kidneys and her spleen. So there's a nice picture of her left kidney right there. So she is panting, so it does create a bit of a movie, but there she stopped for a second, right? And then after I've frozen the image, I have the ability to span back and forth through the previous frames to capture the image that I like best. And then I can do a series of measurements. Ultrasound is really applied anatomy. You have to know where your landmarks are in order to do a proper scan, right? So you have to know that the spleen lies in the left dorsal quadrant of the dog's abdomen, and we're looking at the spleen on the screen here. So like all things in medicine, it's always back to basics, and anatomy is one of the most important
So what
things.
is that black?
Right. So that black structure that's appearing in the middle of the nice healthy looking spleen is a blood vessel. So remember we mentioned how the urinary bladder appears black because it's fluid filled. Similarly, blood vessels are fluid filled with blood, different fluid, but it appears as that those blood vessels, and that's very important. That's one of the things we look at, is looking as the blood vessels course through those organs and making sure that they appear normal. Okay. So we'll move on to her stomach. Looks like maybe she did have some breakfast this morning.
Ooh,
So that's one of the other things that's important about ultrasound is that we ask owners to fast their animals for about 12 hours. They're allowed to have water, but having food in the stomach creates a lot of artifact. So by artifact, I mean the stomach I should be able to see the whole wall of it. In her case, she probably had some food, so there's a lot of doggy breakfast in there that's interfering a bit with our images.
Are dogs this easy to manage on the table?
Leila's doing very well. It really depends on the temperament of the dog. So some of them are amazing and lay here and don't seem to mind one bit. Others do find it, being in a new environment with new people, they become a little bit anxious. So sometimes sometimes owners will come and help us hold. Some dogs are actually better without their owners. It just kind of depends on the dog. In cases where dogs are, distressed enough that it's difficult for them and difficult for me to get good quality images, we will offer a sedative just to make it easier for them and for us. So the other thing about saving images and doing the measurements and whatnot is that in some cases, because I'm a regular DVM, but I have sought counsel from radiologists or other specialists, so I can post these images or short video clips online or send them to a resource that can help me interpret them if there's something that I encounter that I'm not familiar with. I do a lot of ultrasound, but I am by no means a board-certified radiologist, so we do rely on outside sources for support. Good news is Leila's abdomen looks wonderful. Both of her kidneys are equivalent in size, shape, and structure. She doesn't have any enlarged lymph nodes in her abdomen. There's no mass effects, so no tumors that I can encounter throughout my study. There's no extra free fluid in her abdomen. All of her intestines look normal, so there's no changes in the thickness or gas patterns within her intestines. We'll also come up and have a look at her liver. Okay, so again, she's panting a little bit, but there I just froze an image of her liver, and there's also another black structure within there. That's going to be her gallbladder. So just like the urinary bladder and her blood vessels.
So this is her gallbladder. That's
her gallbladder. So you can kind of see how it appears as a black sac there. So the gallbladder it's a fluid-filled structure. In this case, the fluid is bile, and it should appear completely black like that. So that would be an example if I have an ultrasound of a dog, especially if that dog, say, has elevated liver values. I ultrasound the liver. You could take an X-ray of a gallbladder and you will see nothing. On ultrasound, you can see that, oh my gosh, that liver or that gallbladder is infected. So it's full of sludgy material. Maybe it's got stones in it. Maybe the wall's thick. Maybe it's blocked. Maybe there's a blockage in the duct. And that gives us our diagnosis, and then we can make a treatment plan from there.
This is very interesting.
Well, it's certainly very important. As I said before, I don't know how I could practice without ultrasound, because there's so many times where I've taken an X-ray of something, which again is an important modality, but I say, gosh, I really want to see how that liver looks or that spleen looks on the inside of it. And then without ultrasound, the only other way you would have to determine that would be to actually do an exploratory surgery. So that would involve opening up the abdomen and visibly looking at things. And that has its place too, but if you can get your answer without having to do a surgery, you have saved the dog a lot of an invasive technique, saved the client possibly some money, and save time. Before I finish, I always do a nice grid search through the abdomen just to make sure I haven't missed anything that important.
This is not invasive. The dog is laying on its back.
Yeah.
Two amazing vet techs are assisting Leila. Her stomach has been shaved. It's, like, ooh, that's nothing to be upset about. And then your message of information at the end of it all can leave a client, for instance me, knowing peace of mind, or at least have some clarification and clarity of what's going on with my dog.
Right.
And Leila, when, thankfully we didn't find anything that went sideways today, that would not be good, but at least now this dog owner has a starting point.
Exactly.
Right?
Right, and there can be incidental things you can find in an abdomen, so you could have a little benign little lesion in, say, a spleen or a liver, and you might find that on a screen, a health screen, and you might say, well, that doesn't look like a concerning finding. We've measured it, we've documented it, and then we can come back in, as I said, 6 months, a year, whatever we feel is appropriate for that patient, check it. And if it hasn't changed in size or appearance, that means that we know that that particular issue is less likely to be a problem if that patient comes in sick another day. Whereas if the patient comes in when they're ill and I find a little lesion in their spleen, I don't know how long it's been there. I don't know if it's significant in terms of what's going on with that particular dog. So it makes it easier to pursue an illness when one does arise. I mean, let's be honest, dogs, just like people, eventually can become sick from time to time, but the more you know about that patient moving into that particular disease incident means that you can be as effective as possible towards targeting where the problem's coming from.
So Leila gets a clean bill of health from the
She
ultrasound
does.
today?
Yeah, there was no findings in Leila's abdomen that caused me concern. But again, she is a 7-8-year-old Labrador. So I would, at her age, she's an annual exam dog. Now, if next year we find something in there that's a change, then we might change that time window. So we might say, okay, I want to keep a close eye on this, so we're going to check it again in 3 months, depending what it is, 6 months, whatever. Yep.
All right, well, that's a wrap for Brad's Bark on Shaw TV. And Dr. Jessica, thank you so much.